Welcome back to my channel, where I remain committed to keeping you informed about health-related issues that affect us all. In today's video, we're going to talk about something that's a major concern for millions of people worldwide: high cholesterol. We've previously discussed foods that can help manage cholesterol levels in my video on the China study. Links to both my video and the book are in the description. I highly recommend this book to anyone who is trying to rid their bodies of prescription drugs. It's equally important to know which food items to avoid. First, foods high in saturated fats such as red meat and full-fat dairy products should be limited. They can raise your total cholesterol and low-density lipoprotein, LDL cholesterol, the bad cholesterol. Secondly, trans fats, often found in margarines and store-bought cookies, crackers, and cakes, are harmful. These fats increase overall cholesterol levels. Thirdly, foods high in cholesterol like fatty cuts of meat and high-fat dairy products should be avoided. Even small amounts of these can cause a significant increase in cholesterol levels. Fourthly, processed foods, which often contain high levels of salt, can increase your risk of heart disease by raising your blood cholesterol levels. Finally, sugary drinks and snacks, which can lead to weight gain and higher cholesterol levels, should be limited. By avoiding these foods, we can take a big step towards managing our cholesterol levels and maintaining a healthy heart. Remember, your health is in your hands. Stay tuned as we delve deeper into this topic in the next segment. Imagine this. Every year, millions of people undergo coronary bypass surgeries. It's a procedure that's performed with alarming regularity, not just in the United States, but all over the globe. The numbers are staggering. In the US alone, hundreds of thousands of these surgeries are carried out each year. The global figures climb into the millions. But the more shocking statistic comes in the form of the death toll. Despite the advancements in medical technology, thousands of lives are lost annually in the US and worldwide due to complications arising from these open-heart surgeries. Now you might be thinking, that's terrifying, but what can we do? The answer lies in understanding the root cause of why these surgeries are so prevalent, and it's something that you have probably heard before. These numbers are indeed shocking. But what if I told you that the root cause of these surgeries is something we can control? Cholesterol. We often hear it's bad for us, but did you know there's a good type too? Now let's talk about cholesterol. It's a waxy substance that's found in the fats, or lipids, in your blood. Your body needs cholesterol to build healthy cells, but having too much of it can increase your risk of heart disease. There are two types of cholesterol: low-density lipoprotein, or LDL, and high-density lipoprotein, or HDL. LDL is considered the bad cholesterol. When your levels are too high, it can build up on the walls of your blood vessels, forming plaques and narrowing your arteries, a condition called atherosclerosis. This can lead to serious issues like heart attacks and strokes. On the other hand, HDL is considered the good cholesterol. It acts like a scavenger, picking up excess LDL on its way back to the liver. The liver then breaks down and removes the LDL from the body. In essence, the higher your HDL level, the less bad cholesterol you'll have in your bloodstream. But here's the twist. You won't find HDL in a cheeseburger or a stick of butter. In fact, plants contain smaller amounts of HDL, but higher amounts of substances similar to cholesterol, but with a slightly different structure called phytosterols or plant sterols. Foods like avocados, olives, and certain types of nuts and seeds are rich in phytosterols, which lower blood cholesterol and LDL cholesterol levels. Even dark chocolate and red wine in moderation can boost your levels of good cholesterol. So the key to managing cholesterol isn't necessarily eliminating it entirely from your diet. Instead, it's about maintaining a balance. Too much LDL, the bad cholesterol, is harmful, but a higher level of HDL, the good cholesterol, can protect against heart disease. Cholesterol is a complex topic with many factors influencing its impact on our health. But one thing is clear: cholesterol plays a crucial role in our bodies, and it's the balance between the good and the bad cholesterol that is important. So if you eat a mainly fat and meat diet, your cholesterol will be high. If you eat less meat and more plants, your cholesterol will go down. It's really very simple. So, not all cholesterol is the enemy. It's the bad cholesterol we need to watch out for. But what can you do? Meet statins, the commonly prescribed drugs for high cholesterol. They're a class of drugs that help lower blood cholesterol levels, utilized by millions around the globe. The most popular among these include atorvastatin, simvastatin, lovastatin, pravastatin, and rosuvastatin. Each of these has its own unique characteristics, but they are all used to do one thing: keep your cholesterol levels in check. However, like most medications, statins are not without side effects. These can range from mild annoyances to more serious health concerns. Some people experience muscle pain, digestive problems, mental fuzziness, but we will look at the more serious side effects in a little bit. It's also important to note that the risk of side effects increases as the dosage of statins increases. Now let's talk about the sheer number of people who are on statins. It's estimated that nearly 30 million Americans alone are taking statins to manage their cholesterol levels. That's a lot of customers for Big Pharma. Worldwide, this number is staggeringly higher. But it's not just about the numbers. It's about understanding the role these drugs play in our health. The narrative is that statins work by slowing down the production of cholesterol in the liver, reducing the amount of cholesterol that may build up on the walls of your arteries. This, in turn, helps prevent heart diseases. Unfortunately, they don't tell you that slowing down your body from making cholesterol is not eliminating the problem. It is altering your body to accommodate a bad diet. When you begin shutting down pathways in the body, your body can lose its inherent ability to produce necessary components of the body. For this reason and many others, it's not good to alter these amazing machines. It's always better to eliminate the cause of our disease. So, it's always important to weigh the benefits against the risks when it comes to taking any medicine. Also, each person's body responds differently to medication, and what works for one may not work for another. If you are currently on statins, it's important to have an open dialogue with your healthcare provider about your desire to stop statins in combination with a plant-based diet. Go back in 60 days, check your numbers. If you stick to this plan for 60 days, you will be amazed and you will have a new reference on how to lower your cholesterol naturally. Now, we are going to discuss some facts about the power of one's diet in healing heart disease. Did you know your diet alone can prevent and treat high cholesterol? It may seem unbelievable, but your plate holds immense power over your health. Let's take a look at the remarkable work of Dr. Colin Campbell, who has tread a path less traveled in the medical community. He has successfully used a vegan diet to treat heart disease, demonstrating the undeniable potency of the foods we consume. Dr. Campbell's program, based on a plant-based diet, has been shown to clear coronary arteries, reducing the risk of heart disease. Imagine being able to reverse the effects of high cholesterol simply by changing what you put on your plate. It's not magic, it's science, and it's all within your control. However, it's not just about eating more plants, it's also about avoiding certain foods that can raise your cholesterol levels. Foods high in saturated and trans fats, such as processed meats and baked goods, can increase your bad cholesterol. Excessive consumption of these can lead to a buildup of cholesterol in your arteries, posing a threat to your heart. On the flip side, there are foods that can help keep your cholesterol down. Fiber-rich foods like oats and whole grains can lower your bad cholesterol. Omega-3 fatty acids found in fatty fish like salmon also play a role in controlling cholesterol levels. Moreover, fruits and vegetables are rich in antioxidants that can boost your good cholesterol, helping to keep your heart healthy. Dr. Campbell's program shows us that a well-balanced plant-based diet can be a powerful tool against high cholesterol. It's a testament to the fact that sometimes the best medicine is found not in a pill bottle, but in our kitchens. Your diet is a powerful tool in controlling high cholesterol. You are looking at a real patient's coronary arteries before and after only 6 months on a plant-based diet. So when you complain about your heart, remember that it is your creation. Now that we know about statins and diet, let's weigh them against each other. Statins, while effective, come with a host of serious potential side effects that I would like you to be aware of. Muscle myopathy. This is a condition characterized by muscle weakness, pain, tenderness, or breakdown. In rare cases, severe muscle damage can occur, leading to a condition called rhabdomyolysis, which can cause kidney damage. Next, liver damage. Statins can sometimes cause liver problems, including an increase in liver enzymes and, in rare cases, liver failure. Blood tests are typically conducted to monitor liver function during statin therapy. Type 2 diabetes. Some studies suggest that statins may slightly increase the risk of developing type 2 diabetes, particularly in individuals who already have risk factors for the condition. Neurological effects. In rare cases, statins may cause neurological side effects such as memory loss, confusion, and nerve damage. Increased risk of hemorrhagic stroke. While statins are generally associated with a reduced risk of stroke, particularly ischemic stroke, there is some evidence to suggest that they may slightly increase the risk of hemorrhagic stroke, especially in individuals with a history of stroke or other risk factors. So they may reduce ischemic stroke but increase hemorrhagic stroke. One is due to no blood and the other is due to too much. Rare allergic reactions. Although rare, some individuals may experience allergic reactions to statins, which can manifest as rash, hives, swelling of the face or throat, or difficulty breathing. Anaphylaxis, a severe and potentially life-threatening allergic reaction, is rare but possible. On the other hand, diet control presents a more natural, less invasive approach. A well-balanced diet, rich in fresh fruits, vegetables, whole grains, and lean proteins, can significantly lower bad cholesterol levels. Dr. Colin Campbell's program, which advocates for a vegan diet, has shown remarkable success in treating heart disease, even clearing coronary arteries. The importance of diet in managing high cholesterol cannot be overstated. Before you fill that next prescription, remember that controlling our diet is a safer and more natural way to manage high cholesterol. Knowledge is power, and sharing it can save lives. The reality of coronary bypass surgeries, the conundrum of cholesterol, the story of statins, and the power of diet. All these are crucial pieces of information that can make a significant difference in someone's life, perhaps even yours. So, let's not keep this to ourselves. Let's empower others. Encourage your friends and family to understand their health better. Share this video with them. It's a simple click, but it could be a life-changing one. And if you want to stay updated on more insights into natural healing, make sure to subscribe to my channel and don't forget to ring the bell. It's your gateway to a wealth of information that helps you take control of your health naturally. Let's make a difference together. Let's spread the word and help everyone live a healthier and more rewarding life free from Big Pharma.